My name is Andrea Bactol. I'm 24 years old. I was diagnosed with lupus when I was 12. I started getting chest pain. And so we went to just a local hospital nearby my house, and they didn't really know what was happening. So then they transferred me to Seattle Children's. So at Seattle Children's Hospital, that's when I was diagnosed with lupus. As I got older, it turned into lupus nephritis, which it impacts my kidneys now. I was at Seattle Children's Hospital until I was 20 years old, and then I transitioned into adult care around 21. What worried me transitioning into adult care was having to start all over with a new doctor, having to build a new connection with somebody else. And I was just nervous of having to re-explain myself and explain my health history all over again. What surprised me the most about transitioning to adult care was actually how smooth it was for me. My doctor at Children's referred me to my now doctor. And so that helped that they had communication from Children's and my now doctor's office. So I was very surprised of how smooth my transition was. I do feel well supported in my journey. I feel like every doctor that I had in every phase of my life was exactly what I needed at that time. And when I was at Children's, the main priority was for me managing my pain and making sure my health was in order. And my doctors at Children's were really good at prioritizing that. And now, because fortunately my health is, managed, my pain is managed, my doctors now have been great at basically just helping me keep my health stable and just me wanting to just live my life. Transitioning to adult care, I became way more responsible for my actions. When I was younger, I really relied and was codependent on my mom. She really helped me a lot, and she was a nurse, so I feel like naturally she knew what to do and she wanted to take care of me. As I got older, I finally accepted, my health condition. And so that allowed me to finally just take charge of my health. For example, just fill my own medication, finally not being stubborn anymore and wearing a hat in the sun, listening to my mom, for a change. My advice that I would give to other people transitioning to adult care would be, I always tell myself in whatever experience I'm going through is whatever I get out of it is what I put in. And so that just means being able to be honest with myself and with my doctors with how I'm feeling mentally, emotionally, and physically. Other advice that I would tell people in transitioning to adult care, check up on your parents. It's important to realize there are and were other people involved in your health journey, not just you. So check up on your parents, check up on your siblings. That would be also important.